Alrighty, good afternoon, everyone. Good evening. All of that stuff above. Thanks for coming out. My name is Mark Jenkins. I'm the Executive Director of the Greater Hartford Harm Reduction Coalition, and on behalf of the wonderful city of Hartford and its health department, we'd like to welcome you to this community conversation.
Hi,
my name's J.C. McCauley.
I'm Naisha McCauley, and you're watching AccessTV.org.
It's going to be just a very informal conversation of where we are now, in retrospect to this opioid epidemic that we presently find ourselves in. We were fortunate enough last year to have a few forums and some great guests come out and share their experience and the work that they were presently doing at that time as a response to the epidemic, or the opioid epidemic. So this really was another attempt to meet again, a year later, and see where we are. There's a lot of work that's been done, both from the core response, the Alcohol, the Drug Policy Council, money's coming down through STR, various organizations which are also represented here today. But again, just to get a feel for where we are and where we're going. Some of the things that are being done. There's a lot going on in the community. This is going to be a community discussion, so we're going to be real light up front, which, as you see, we're lucky to have the new Director of Health and Human Services, Ms. Lilany Arroyo, Deputy Chief Foley from the Hartford Police Department, who I just so sad to say that, he's going to be moving on, and he was really instrumental, believe it or not, in me deciding to put together the fentanyl testing project that we did last year. And also Karen Hekeler from Northeast Pharmacy Consultants, who knows a lot of the information, especially for those individuals or agencies that are here that would like to make sure naloxone gets directly into the hands of the people that need it most versus people getting prescriptions to actually put the product into their hands. So there's, some easy steps, and she'll be able to elaborate more on what's happened along that line as well. So without ado, I'm sorry to say Dr. Heimer will not be with us tonight. He had surgery on his knee, and doctor wouldn't clear him to come out, and he said, but it's okay, the prescription they gave him is helping out quite a bit. So, and Martin Jackson as well. I'll say, if you believe in prayer, pray for him. He's going through some things also medically, so he won't be with us. And he'll be sorely missed, because I was really looking forward to him emceeing this and moderating this, and not myself. So, but without further ado, and I'm going to be looking at some of you out there. I see you out there, Eliza. I'm not going to put anybody out front, but I'm going to call on Andrew. So, without further ado, I'd like to introduce Ms. Lilany Arroyo.
Oh, I'm starting?
Thank you all for being here this evening. Thank you, Mark, as always. I've only been on the job, it'll be 6 months next Monday. So I guess I can't say that I'm still new, but I'm happy to be here. My first meeting actually as director was here in this room. Just give a little bit of information about who I am and how I got here and why this is particularly important to me. I am a Bridgeport, Connecticut native, born and raised in Bridgeport, and left about 19 years ago, always with a desire to come back to Connecticut, to my home, and to be able to make a difference here. So I was very lucky enough to meet the mayor and was excited by his enthusiasm for the city and what Hartford has to offer and where Hartford can go. And one of the first things he said to me was, I have many priorities, but there's a couple that I think are the highest priorities for me. And the first one he said was the opioid epidemic. So I thought that was, for me, having someone just come out and say that as one of his first big things that he wanted me to address when I came on board was very telling about the type of person he is and where he wanted to make an impact. The second piece was around teen pregnancy. That's a lot of my background as well. I've been, like I said, been on the job a little less than 6 months and been really digging into the data and digging into what's happening, learning about Hartford and what the epidemic looks like in Hartford. And I think many of us know, and I spoke a couple months ago at the Urban League, you know, what we see on TV is not necessarily the face of the epidemic here in the city. And I think that's important to acknowledge. While we're talking about what's happening, for many of us who have grown up in urban areas and in urban centers, what we're seeing is not necessarily new. The deaths are obviously how the increase that in the deaths is relatively newer, but heroin addiction and addiction to opioids is not new. And so from my perspective as the health department and wanting to look at this is wanting to acknowledge that, and in wanting to acknowledge how we might approach the epidemic at a city level in a way that's a little bit different than some of the surrounding areas. We've been lucky enough to now, through the state, get access to data firsthand rather than waiting for them to give us. And I know that Deputy Chief has some other data to share. I just want to give an overview of what's happening in Hartford for the years that we have some data. So from 2012 to 2017, in the city of Hartford, there were a total of 428 deaths due to overdoses. Over half of those were actual Hartford residents. I want folks to be clear about that, because we hear this big scary number, and I think it's good to know how many people it's affecting within our city limits. About half of those are amongst Latinos, but we also know that the number of deaths are increasing rapidly in the African American community, and so there's some work that needs to happen there as well, and we'll be looking at that and digging deeper into that. You know, what we hear about deaths, oftentimes people are wondering where they're happening. Are they happening in hospitals? Well, the data here for the city of Hartford show they're happening in people's homes. And I think that's important to know because it gives us an opportunity. It gives us an opportunity to reach families, to reach the people that love individuals that are struggling with addiction, with a lot of the work that Mark and his team and the Deputy Chief and Chief Freeman are doing, are getting folks with Narcan, getting folks out there trained to use that. And the work that we're doing in the city and supporting Mark's work is doing exactly that. Getting this into the hands of people that love someone that may be addicted and struggling with addiction so that they can save their life, so that they're alive when they're ready to make a change. And that, I think, right now is key. The other part I think is critically important is to also address the prevention piece. We want to keep people alive, but I think growing up, as I'm about to hit 42 years old, I still remember as a youngster getting a lot of education around drug use. And I'm not talking about the old days of doing DARE and all of that stuff, but just being able to have good information for parents and for caregivers to talk to their children, I think is important. And so while I'm very pleased that we're working on making sure that people have access to Narcan and know how to use it, I think for me, a big piece of this is really focused also on how can we now also turn to prevention, right, and treatment. So as the city does have a commission on substance abuse and addiction, and that's something that we're looking to restart again. We think it's a good time. There's a lot of interest. I hope that through that commission, we can identify more ideas, better ideas, promising ideas, from people that are doing work on the ground, like Mark and others, so that we can work to take them to scale in the city. But I also think there's a need to have a regional response, right? Folks are coming in, they're coming into our city, they're scoring here, they're doing drugs here. We need to make sure that we're working with our cities that are surrounding us and the health districts around us. We can do as much work in the city, but it doesn't mean it's gonna the data's miraculously gonna change unless we're working with our partners in the surrounding areas. So I'm gonna stop there, so that way we have time for questions and conversation.
Alrighty. Okay, thank you. Next up, we have Deputy Chief Foley of the Hartford Police Department. I think when Chief Foley stood out to me, or the work that we were doing, is there were a string of overdoses. This one was over on Green Street. 3 men the same evening were found in a unit. And Chief Foley was being interviewed, and he said something that just struck to the nerve or to the heart of the work we do as harm reductionists. And that was, at the time, he said, if there was something that was not good, or if there was a bad bag on the street, that we wanted to get that information out to our drug-using communities. And so just the way he spoke that just spoke to him at that moment as an individual, and was like, that's somebody I want to work with. You know, he's always busy, and he's the face of the department, you know, on camera, everyone knows. But there's so much more to him, and I'd like to introduce Deputy Chief Foley.
Thank you. Thanks, Mark. As he said, I'm Brian Foley, Deputy Chief, Hartford Police. I got into this whole opioid addiction thing about 12 years ago, and at the time, the police chief at that point and I didn't see eye to eye, and he gave me a punishment assignment out in Frog Hollow, where he wouldn't have to deal with me around the station, and I was assigned out in the Frog Hollow, and it ended up being, without a doubt, the most rewarding position I had in my career. It was just so great, and I was there about 5 years. But unfortunately, I sat in the front seat to watch the opioid crisis bloom in full bloom, and watch it go from pills to heroin. And we'd run operations, narco operations, as we always typically did, and because this is all we knew how to do back then, where we'd arrest buyers and then get them to turn on the dealers, and then we'd get the dealers and move up the chain from there. But you know, we do larger sting operations, and we'd grab in a bunch of dealers, and you know, you'd have moments of clarity when they're sitting in the station house and they're realizing where they're going, and you're talking to them, and you realize this used to be, you know, how did this person end up here? How was the addiction so bad that you're sitting here in Frog Hollow buying heroin with money that you stole from things you bought at CVS, and it's just, or stole at CVS and then sold to someone else, and now you're using that money for drugs, and this is what you do every single day. Like, what happened? And 95% of the people we talk to, in those moments of clarity, you see they were at one time these great people living these great lives, and the addiction has just gotten the best of them. And 95% of them said they started with pills and prescription narcotics, be it from an injury, be it from taking it with friends at a party, and they all started with pills. And we began to realize that the opioid crisis did not start from drug dealers on the streets of Hartford, that it started from overprescription of painkillers around the whole country. Another thing that I painfully realized is, you know, when you're arresting that mother that's addicted to heroin, and she's in the back of your car, and it's 4 in the morning, and she's turning tricks, and you're talking to her, and she's crying and begging for help and begging to get off heroin and begging for addiction services. As a cop, there's not a damn thing you can do other than to bring them behind bars, and that's the worst thing we could do to someone. And I would sit there. This is, you know, I'm no genius. I'm just a cop sitting here thinking this is not going to do any good. She's going to go to jail. She's going to sit there for a couple hours. She's going to get released, probably fail to appear, and the cycle's just going to keep going. She's going to be depressed, sad about everything that's happening. We're just making it worse. And so it gave us a good perspective as we moved forward in our careers, a bunch of us in law enforcement that moved up the chain. It moved into the HAP program that we're doing now, and that's arrest diversion. We realize painfully that we're not going to arrest our way out of this addiction problem, that we need to get people into services. As Mark spoke of, the awareness factor, which has brought some success, but I believe that was the New World bags back then, and there was no one was tracking the overdoses. We didn't get anything from the medical examiner saying, hey, there's a whole crap load of overdoses and you guys better do something. It wasn't that at all. It was literally my sergeant and myself sitting in the office, and we heard another overdose come in on the radio, another overdose. And we deal in deaths, all kinds of deaths, natural deaths, criminal deaths, overdose deaths, suicides, everything. And you kind of listen, and that's what we did. And I remember looking at my sergeant saying, is that another overdose? That's weird. And we realized, I had him pull our numbers of what we had on overdose, and we didn't have a lot of in-depth stuff at that point. And we realized it was a sharp incline. So there's 2 times I had walked down to the chief's office. This was the New World, the bags that were poisonous and causing the overdoses. I had walked down to him, hey boss, we just had 3 in like 2 hours, all the same bag. And he, without Mark's making it sound like I'm the smart one, I'm not. My boss he said, we need to get this out to the user population right now. And as his advisor, I said, hey, this is not going to be politically smiled upon by everybody that we're, advertising our heroin problem here in the city. And he was adamant, we need to get it out to the user population. I said, okay, I agree, let's do it. And we did. It got a lot of attention. The other time I went down in the office was when we noticed the overdose crisis. And again, we just got lucky to be out there, and we were the first ones to get out in front of the news and say, we have an overdose crisis. I mean, go back and Google it here in Hartford. You'll see, before anyone in the state was talking about it, we were here in the city. And I say that not to brag, although it's certainly nothing to brag about. I can tell you, as she just gave you some overdose statistics, we are heading in the right direction. And it's kind of early to say that as we're only 5 months into the year. But I can tell you that last year at this point we had 33 overdoses as we were skyrocketing up. This year we're at 17. That's just almost half as much as we had last year. That's too big of a number to ignore and call an anomaly, especially 5 months into the year. So we're cautiously optimistic, but the reason I say this is I think we're ahead of the curve here in the city of Hartford. We were the first ones to jump out. We're the first ones to get Narcan out there as fast as we can, the first one to make people aware of the fentanyl. And then such a great community, city structure, and everyone involved that cared and understood addiction and understood how poverty plays into drug dealing and the roles that everything has. And we're able to start making an impact before anybody else. All you're hearing about is people's numbers going up, and we're starting to come down. And now 17 is nothing to spike the football over. It's still more than we had in all of 2012. But it's at least we're heading in the right direction and have an impact. Mr. Jenkins and his people for getting the Narcan out certainly play a huge role, and public safety having Narcan as well plays a huge role. But we are heading in the right direction. Diversion is going to be a big aspect for the police department. That's diverting people away from arrest as opposed getting them away from arrest and into addiction services. As I spoke, because arresting is not helping for low-level offenses, not for dealing heroin, but your prostitution, your shoplifting, your simple possession, that kind of thing. We're trying to get people into beds because the numbers are too high. And if it took us 10 years to get into this problem, it's going to take us 10 years to get out. So again, 17 is nothing to brag about. Again, it's more than we had in 2012 in the entire year. So it's going to take a while, but we're heading in the right direction. And I thank all of you for allowing me to speak, but I thank you more for caring about this horrible thing that is gripping our entire region. And I appreciate the opportunity to sit here in front of you. Thank you, Mr. Jenkins. And that's all I have right now. I'll be happy to answer any questions.
Thank you, Chief Foley. For those who are not aware of the HAP program Chief Foley spoke of, it is structured similarly to a program nationally that's called LEAD, Law Enforcement Assisted Diversion. And what happens is, well, where it was initially developed in Seattle was they had certain nights where, in this district where they ran the program, that officers, when they encountered nonviolent criminal activities, instead of making the arrest, if it had to do with the individual experienced opiate use disorder, they call a recovery manager, and this individual would either come out and meet the individual, or they had 24 to 48 hours to meet with the individual, get them assessed, and find out what the issues were, and began to work to reduce those barriers so that the person could become more productive. Not necessarily drug-free, but reduce those barriers and deal with the issues that were causing them to create these offenses. So the HAP program is modeled similarly after that. I'll say similarly because, you know, as Hartford, we do some things our own way. And I'm not going to give it a black eye. So we're, you know, it's getting worked out. It's getting into the mainstream, and it's not going to happen in the North End. It's going to happen only in the South End, because I guess the state said the North End already had a few programs going on. Again, that's the political stuff. That's above my pay grade. But moving along, our next guest, Karen Hekeler, will help us to address it, and I really wanted Karen to come in. There are other organizations here, and I'm glad to see you all. We also have a pharmacist on hand. Anthony came out from Cure Pharmacy. One of the things that we've sought to do is make sure that naloxone was readily available, as Chief Foley said. And Ramon's here from DPH, and big kudos to Ramon and Marianne for developing the open access program, which allows us, organizations such as myself, to get the medication out there. It's one of the things that we've done since day one is, by hook or crook, make sure we had some medication available to get into the hands of the people who need it most, and those have been the doors that we kick. And occasionally we get some responses back, and one that came up recently, if you'll bear with me, I got an email from a gentleman who said he had used his medication recently, and I'll just take a moment and put him on Front Street, if you will, and ask him to talk about his experience.
Well, thank you. And so I'm Dr. Mark Boxer. I'm an epidemiologist by training and have been in healthcare my entire life, and decided to carry Narcan with me. And it went from the abstract to the real very, very quickly. So about 8 weeks ago, I was on a flight from Columbus to Boston, Massachusetts, and about 25 minutes out of Boston, a woman passed out 6 rows behind me. About 25 years old, the same age as my daughter, and they obviously made the announcement, any medical professionals on the flight. I got up, another health professional got up, moved the woman into the aisle, assessed her, and very quickly determined that she was in an overdose situation. They actually made an announcement. They don't carry Narcan on flights, and this was Southwest, and they made an announcement asking, does anybody have Narcan? I remembered quickly, I had it in my briefcase. I was the only one on the flight who had Narcan. We administered it to this young lady, and within a minute, she went from blue, not breathing, to breathing again. And by the time we landed, she was able to get up and walk off the flight. Now, obviously, they took her, in an ambulance to the hospital, and the EMTs responded with the state police. But this very, very easily could have been somebody who didn't survive or ended up with brain damage. And by simply having the Narcan that I obtained through this organization, we're able to bring her back. And so, as I said, it went from the abstract to the real quite clearly. And I come back to what the Surgeon General recently said, which is we need to train an army of people that treat Narcan just like CPR AEDs, make it accessible, take the stigma away, and make sure that we've got an army of people that are trained to use it and have it available to use so that we can save lives. And I come back to the points that were eloquently made up there, which is there are three legs of the stool, in my opinion, that have to be addressed. One is we've got to get to the prescribing habits and patterns to make sure that we're reducing, right, the dependencies on these pain medications that start the trend of people getting addicted. So we've got to work with delivery systems and healthcare professionals to reduce the use of these pain medications and find alternatives to pain medications. Appropriate prescribing, one. Two, for people that are addicted, we've got to get them into behavioral health programs, and we've got to help them get away from the addiction. But the third leg of the stool is for people in a crisis, right, we got to save their lives so we can get them into the programs, and that means making the access easier, right, and making sure people are trained, and making sure, as the Surgeon General said, that army of people have it to use on a Southwest flight or in the city of Hartford or in their workplace or anywhere else.
I couldn't have segued that any better because we want Karen to give us some information, on what she does.
Okay.
All right. Thank you.
Hi, thank you everyone for having me here. 2016, Connecticut allowed pharmacists to write prescriptions for Narcan. They had to take a 2-hour training class, and little by little, by the end of 2016 into the first quarter, a significant number of pharmacies had a pharmacist trained to do this. By August of last summer, all the chains, most of the independents, could write a prescription for anyone who walks in. At the same time, we were kind of seeing that whether it was friends, family members of loved ones, they weren't coming in to get prescriptions. They weren't flocking into pharmacies. So the state approved something that, in Connecticut, is the only state, I believe, that has approved this model where pharmacists can go outside their pharmacy to actually write and dispense prescriptions. The first event was last March, and Greater Hartford Harm Reduction hosted it up here in Hartford. And since then, there have been nearly 100 times where pharmacists have been out in the community. Halfway houses, recovery homes, sober houses, did a soup kitchen last week. Many of them are public training events. There's one going on right now with the DEA and Waterbury firefighters and police and Waterbury tonight, where a pharmacist is on site to dispense. So that's basically what my role is, connecting any organization to pharmacists that can actually go on site to wherever the venue is to actually write and dispense Narcan. Does anybody have any questions?
All right. So, in addition, and I'll kind of tag team this, in addition, as I said, we have Anthony here from Cure Pharmacy. One of the things that we seek to do is, again, for those agencies that would like to get this information direct, or the medication directly into the hands of the individuals who need it most. Sometimes they think of the obstructions, the things that prevent it from happening. So if we can today, through Q&A, is shoot down whatever myths or barriers that you think might be there so that you can bring this back with you. In addition, we have some others in the house. I'm glad I see Carol. Also, someone from Clean Slate is here because we've had more access for individuals to medication-assisted treatment. I see Robin is here, Robin Deutsch from Hartford Hospital. More access to medication-assisted treatment, either methadone or Suboxone. even Vivitrol. So I'd really like to get some input, if you will, and she knows I'm coming to her because I was trying to get her up here anyway. But Hartford Dispensary has also. I'll let her tell you. Miss Eliza Castro.
Hi, everyone. I would like to talk about what areas we have in reducing barriers to obtain naloxone for folks that don't have Medicaid or commercial insurance and are self-pay, and availability to them at a free or reduced cost.
Yeah, but do we want to start with that question? We might have some responses to that, providing naloxone.
Sure. Anthony?
Hi.
So did you catch your question?
Oh, question?
Providing naloxone for folks that don't have Medicaid or commercial insurance
Okay.
at a no cost or a reduced cost.
I don't know about no cost, but we can reduce the cost as much as we can. Sorry, can you hear me now?
Yeah.
I don't know if we can do it at no cost at all, but we can reduce the cost as much as possible. Right now, we can do it for like 135, 140
For adults.
adults, yeah. Right? Actually, it comes in about 2 sprays in a box.
Yep. And I apologize. I shouldn't have put you on the spot on that one, Anthony, because the question was if there is any medication available at low cost or no cost. And the answer to that is yes. Through Greater Hartford, we will make sure if someone needs access to medication, if they are a person who injects drugs, we most assuredly always have that product, an intramuscular dose, on hand, which nationally is the most cost-effective method of administering naloxone. So we can actually get about 10 times as much of the medication as an intramuscular dose as an intranasal. So we always have the intramuscular on the shelf. We do a training open to the public every Thursday. We have for over 2 years now, to make sure the community, and really not just the community, because I'll be honest with you, we've been doing this for over 2 years, and the majority of the people that have taken advantage of the low or no cost medication have been from outside of Hartford. So yes, the answer is yes, the medication is here, it's accessible. If people do have insurance and you want to have it at the agency or brought to you, that's something that Anthony will make sure that, takes place. I'd also like to ask Carol. Carol, you all are doing some new things over at, you all have changed names and everything. So we still in the world refer to them as Fish Fry, but she'll give you the name of her organization now.
It's called Healthcare Resource Centers, and we do healthcare resource centers on Fish Fry Street. And I just want to tell a very brief story that I happened to be in Springfield doing an accreditation visit talking to the medical director, and he said that they called a medical emergency, and it wasn't even a patient of theirs, but it took all of their Narcan. They had 9 doses at the clinic, and the woman was revived after administering all the Narcan. So not only accessibility, but with the proliferation of fentanyl in everything that people are doing, there's more and more that's needed. People have, I think, a false sense of security, much like HIV and antiretrovirals. There's medication that can take care of it. We hear younger patients saying all the time, I've got Narcan at home. Well, if you have one dose, that may be woefully insufficient. So I think that's a huge issue. And I wanted to address also the lack of drug courts in Hartford. It's something that's needed. Kathleen Maurer, who's the medical director of the Department of Corrections, is doing an incredible job in trying to get medication-assisted treatment in correctional facilities so that when people come out who are most at risk for overdose deaths because they are sort of virgin in their state. So it's a multifaceted approach that I think we're all talking about.
Patients, they get the medication. Most of my patients have got their prescription and they have gone into the pharmacy and got the medication. But one of them, the insurance didn't approve, so the pharmacy didn't give him. He tried a couple of times and he just gave up. So, and I would like to have more information to share with him how he can get the medication.
Hi. I hear a lot of talk, I've been to several of the forums, I hear a lot of talk about early intervention programs are getting a lot of funding. Obviously, naloxone is, and these are well needed, but what I'm seeing a real lack of are support services for those, especially in very early recovery. It seems to me that a lot of people think the end of the line is getting someone into detox and getting someone into rehab, and I can tell you, having experienced this firsthand with my daughter, that is certainly not the case. People, in my opinion, need more resources to avoid relapsing because it's such a huge problem. And the incarceration talk kind of reminded me of that. You get out and you're lonely and you need job training. I don't see vocational skills being offered to people. So I think this is something that we should consider adding some more funding to. Thank you.
So really, we like to and deliberately kept it light on the top end to be able to address any questions that you may have.
Questions for Assistant Chief Foley. You said that we made, like a 50% cut, and you what exactly do you attribute that to?
Your guess is as good as mine. What they
My
what
question was, there's been a 50% cut in the number of overdoses. Why? Is that we over the hump? Why are we over the hump? What's different this year?
It's kind of like when you take a gun off the street, you don't know if that gun was going to commit a murder or not. Down the road, I see more Narcan in the street. I see a city that's aware. I see a community that's involved and aware as well. Again, but it's not time to celebrate by any stretch. In fact, I've seen the city so many times when you start making improvements, they make cutbacks. And if we're heading in the right direction, damn it, double down and hit it harder. And we fail to do that in so many different areas here in the city, and it affects the police department all the time. When it does happen, it seems like we get hit. But the awareness, the addiction services, the legislation improvements, there's just a lot, there's so many things at play here. I can tell you our enforcement efforts, aren't one of the top reasons, but we are just doing a ton of it because the fentanyl's out there and we got to get it off the street. But the more we pull out, the more that comes in, and so there's always going to be a market, unfortunately. But definitely the fact that the community's so aware, and that people like Mark are out here getting that Narcan out there, that the ambulance drivers have it, the fire department has it. Mark trained our detectives for them to have it when they do the search warrants, because the dogs were overdosing nationally occasionally. So just the awareness ahead of time, I think, is we are ahead of the curve, and so people should look to all the good things that we are doing here, but by no means celebrating any sort of victory.
In response to that, are you also tracking not just the death, but the calls to respond to overdoses? And are there more calls to overdoses, but then there's not as many deaths?
So not every overdose that gets treated with Narcan is reported to the police. And so we've closed the gap with the hospitals, where they report to the city to some degree all their overdose treatments. But no, they are tracking them through EMS and fire now through them, because we don't go, the police department doesn't go to every overdose or one that goes to the hospital. But that's a good question, because that's an indicator. I'm saying that deaths aren't going down, or the deaths are going down, but I'm not saying the addiction is slowing down by any stretch. So again, not time to spike the football and celebrate.
And there was some other numbers, and maybe
I'll touch a little bit upon that. I think you hit a very important point. It's something that we've been talking internally in our department, and the chief just walked in, Chief Rosalo just walked in, but we had a very brief confab at the end of a meeting today to discuss exactly that. It's not just knowing where the deaths are happening, but it's knowing where the calls are happening, where people might not want to go to the hospital, where the activity is happening, so that we can sort of surround that area with resources, with information, with partnering with the right agencies to say, look, like, this is happening in this area. Like, they're not going to the hospital, they're not, dying because they're getting treated, but if we're seeing these spikes in certain neighborhoods, and not just by zip code, because I didn't get a lot of data by zip code, but I want to know the block that things are happening, or the blocks that things are happening in, so that we can then bring all that data together and say, hey, this is where it's happening. Mark, Deputy Chief, like, let's get together and figure out what are the resources there that we can bring to bear in that area. And I will say, as a city, on the health side, we get $30,000 a year to deal with this. That's it. We're working very hard to do some of the work that you're talking about, to identify other resources to do that. One of the things I've done in my past career is raise money, is grant write and fundraise. And that's a big part of why I'm here, and I want to be able to have the data that I know makes a difference to be able to do that. So it's at the top of my agenda to be able to do that. But having that data, I think, is a critical component. And I know the state is starting to recognize that it's not just the deaths, but it's actually the overdoses that are being seen that don't result in death that we need to know about, and then we need to know where they're coming from too, so that we can do this work.
And I'd just like to add on that, AMR is doing a pilot program. They're doing it, I think it's like half of Hartford, where first responders are now calling poison control to report the specifics of the case, and they're mapping it out. So if there's 2 on Park Street or whatever in a certain period of time, they can actually see it on these live maps, which is going to be phenomenal if it can be implemented statewide.
Just curious, Chief, I'm going to put you on the spot. Are you seeing less fentanyl in the streets?
No.
Same.
No, we expect to see fentanyl. A couple years back, it was, there may be fentanyl coming, or you may start seeing it, and then we started to see it here and there mixed with heroin, and now we expect to see fentanyl in every single search warrant that we do to some degree, unfortunately, and it's just so toxic.
So it's not, it's not less fentanyl.
No, in fact, there's more fentanyl than there ever was by my estimation.
This question also goes to Chief Deputy Foley. Aside from overdose deaths, the amount of death and destruction, I think, caused by opioid use and in the drug market is hard to measure. I can't help but think some of the recent spikes in shootings and in vehicular incidents are related. It might be too soon for this year, but as far as last year for the crimes, do you know the stat of violent crimes that were attributed to either people involved in drug deals gone wrong or the amount of violent offenders who were high? I'm wondering if there's a correlation between the incidents in violence crimes and just the proliferation of the opioids?
So in the 90s, you had the crack epidemic and the violence associated with it, but you didn't see the violence with the heroin when it was less in demand and there was less distribution going on. But over the last few years, absolutely, we've seen an increase in violence in the heroin dealing factions of people out there in the city. It was just crack and it was never heroin. You just never saw it. You know, and occasionally with weed, but now you're seeing it in the heroin because there's, you know, obviously a lot of money, unfortunately, to be made in that, and then with that comes the violence and opportunity for violence. So yes, I don't have an actual number of how many were drug related, but too many would probably be the best answer.
So I just have a quick question. I mean, I think it's great that, you know, everything that they're doing with the opioid awareness and all of that. But what are they doing, or is there anything that's being done to capture the attention before it becomes an addiction, or for the youth and adolescents that are growing up that are seeing this and picking up these patterns? Is there anything that's being done to address that, or is there any funding going towards that?
Funding for my department at this point, no, but it's the area that I'm very much interested in. I think, you know, obviously prevention is critically important, and I think we're focusing on treatment, which we need right now because it's sorely lacking. But for me to re-up this Substance Abuse and Addiction Commission and to work with with the two chiefs, Chief Freeman and Chief Rosado, around this, a large part of it for me would be prevention. I think, you know, the gentleman here was alluding to that when we were talking about responsible prescribing. That's prevention, right? I think it's just more than that as well. It's not just the prescribing piece. I think there's work in our community that needs to happen. I think we need to educate our caregivers and our parents about what to look for before things get out of hand. For me, as I'm looking at this and I'm looking at opportunities to create programs and to create strategies, that's a big piece of it. At the current moment, though, the answer, unfortunately, is no. There are other community groups that are doing things. I'm not going to say that there aren't. I think having a more comprehensive and more working together is probably what's needed, and I hope that we can do that over the next couple months to find ways to do that.
To answer the question of the gentleman right here asked the question in regards to why is the change from last year to this year, and working for our faith-based organization with my wife and the team that we have that go out at night 3 times a week and feed the homeless. We've done the training with Mark for Narcan, and what I can actually say is that it's not so much that there's not enough fentanyl, because there is a lot more fentanyl, but the fact that everybody out there has been able to receive maybe a Narcan kit from Mark, or they have been able to actually have their own Narcan with them. And I personally have heard from some of these guys who help each other out if they're using drugs, and the guy next to him just got an overdose. Well, thanks to harm reduction group, they were able to have a Narcan kit to be able to use it and save that person's life. So it's not so much that there's not enough, that there's fentanyl issue, is that there's more information out there and there's more resources for them to have these things. And I think that plays a big, big role as far as the police department being trained, the fire department being trained, the people even in the streets or family members being trained to be able to use this medication.
And I want to add real quick, I really would love to believe that our efforts are helping. One of the things that we also do is, and you'll see up on the billboard over there, the fentanyl testing and reporting project, is that here in Hartford we have tried to make sure for our participants that they have the ability to test their product prior to using it, which allows them, once they see it has fentanyl in it, they can make an informed decision to tailor their intake, which would also help to, reduce those lives. But there's something happening, because we know from January until the end of April, there were still over 3,000 overdoses in Connecticut. 3,090 is the number that they put out from January to the end of April, and the 27 EDs that kept those numbers non-fatal ODs. And again, Hartford led the way. So hopefully we are making some progress in getting this medication into the hands of people that need it, and we're looking to do more. But I want to take a moment, if I may, and introduce the community, or ask the chief if he would come up and introduce himself, and we'd love to meet you and hear from you if you would honor us. This is the newly appointed Chief of Hartford Chief of Police, Chief Rosado.
So I was not here prepared to speak, so I apologize. I was just coming from a meeting with the mayor, but we have the good deputy chief here who I'm sure did very well. David Rosado, born and raised here in the city. I'm happy to be here. It's been about 4 months now. I've been around around the city for the different NRZ meetings and the different community meetings that we've had, and I'm really proud about the city. It's very active. It's very, the community is very active. The community cares about the city. That's a message that's lost in the suburbs. You know, we talked about that earlier. The folks in the city have this perception of the city that's not necessarily accurate. This is what's accurate about the city. Folks who care about relevant issues that are going on in society. And we have, I just want to say for the police department, part of it, we have a police department that's very engaged with the community. That's something that I take pride in, and that's something that we're going to foster. And on one last moment, I just want to deviate here. I just want to recognize a great career in the police department. Deputy Chief Foley is retiring tomorrow.
Thanks, Chief. Thank you. I'm flattered. I'm not going far.
So the great relationship that we have with the community, Deputy Chief Foley has a lot to do with that. He was instrumental in being transparent with the police department. So I just wanted to say thank you in front of everyone here, Chief. Thanks you for what you did.
Thanks for the kind words, Chief, but the relationship with the community is a two-way street, and if everyone wasn't so great to the police department, we would not have this great relationship. And I see so many friends in the room right now that we've worked closely with. So my hat goes off to you. Thank you for making my job easier. I love you all, and I look to continue down the road.
Okay.
Sorry, one more. Skipped.
Hello, my name is Jamie. This is for the pharmacists and everybody that's actually giving out the Narcan. Should you inform them about the Good Samaritan law at the same time? Because a lot of these safe houses where people use, they're afraid to call the police because they're afraid of getting arrested because there's drugs in the house.
That's part of the required training when a pharmacist writes a prescription for Narcan. He's got to not only show them how to use it, but provide that information to them. Good question.
Do we have any ways to track data for deaths that are occurring due to drug use that are not overdose deaths? For example, someone who's used crack for a long period of time and has a sudden heart attack. Is that something that can ever happen?
Yes, no, those statistics would come out of the OCME. When someone passes away, their blood is tested, and then it's the presence of whatever narcotics or whatever's in their system that caused their death. And the OCME tracks that very clearly. Many of our overdose deaths come in with heroin and cocaine in there, and obviously, all sorts of things in there. So, yes, they do track that. Now, as far as how readily available those statistics are, you have to deal with the state OCME. But certainly, we get every death we have, we track afterwards as to what killed them. Right. Yep.
Mark, you and Greater Hartford Harm Reduction is viewed as the premier experts on the ground out here in the community, not just in Hartford, but around the state. In your opinion, what is and continue to be one of the chief impediments or gaps in terms of you guys getting out there doing the work that you need to do to get to some of the folks that, quite frankly, a lot of folks have a difficult time, one, interacting with, engaging, and maintaining relationships with, to continue to get these services to?
I don't like for anybody to ask me anything in my own words in public.
What can we do to help you and support Greater Hartford Harm Reduction Coalition?
Alex, Terry, stand up. Jose, Tammy, Barbara. Am I missing? My college team, Clarissa. You guys, stand up. A faith-based organization, stand up. These are the individuals from the community that go back into their communities and do the work, engaging the people, getting the information necessary to pass on. This is how we get back into our communities and begin to, have an impact by using peers, by using gatekeepers. We are able to do things like, you guys can have a seat, thank you. The bottom line, what's needed? Funding. I never like to make this about me or us when we do these forums, but we've done what we've done without money. Not because we want to, Trust me, I'd like to pay a bill, but because we've not had funding. But I guarantee you, and no disrespect to anyone, we'll run circles around anyone doing the work because this is what we do. We're light on our feet and we can do it, we can adapt, we can change, we have the latitude to change, to go where there's need. We have done projects, as Angela spoke about, on the Good Samaritan law. Our information talks about the Good Samaritan law. We talk about safe injection practices. We talk about other health issues like, why we give out crack kits and what's in the crack kits. It really comes down to traditionally and the smaller agencies that work within their communities don't ever survive long enough to receive funding to continue their work. This is what I've seen. So, bang for the buck, mission values, getting the work done, really being able to collaborate, because no one agency is going to be able to make an impact. However, through collaborations, collectively, we can make an impact. It's wonderful when I know our participants come to us and tell us that this church group came through and they actually cared. They worked with us. Then you know what? Then that's who we partner with and make sure that they have the equipment necessary to increase their reach to that population. And the same with the college students. We're about to open a drop-in center in a pretty challenging neighborhood at 555 Albany Avenue. And that's where our college team is going to come in. That's where our ambassadors are going to come in. That's where our nurses are going to come in. Where we can begin to engage these communities in non-traditional hours, evenings and weekends. There, so many other things. Again, I talked about the rover. I really want to, make this about you all. And if you have some questions, because this really is where, if there's a question you have about how you can make an impact, how can we help you? Because that's what we exist to do also, is to help you increase your impact to the people you serve. You know, we're lucky to have relationships like with Dr. Deutsch, she's here, and others, you know, Dr. Boxer. So if you've got some more questions, let's keep this going. Did I answer you, Andrew?
You did all right.
So first of all, thank you all for being on the panel tonight. And this one is for Director Arroyo. And so the question I have is, the mayor has done a great job of partnering with the business community, doing outreach, jobs programs, things like that, job creation. And I just wonder whether there's an opportunity to meet people where they are, to partner with the business community, run classes, make Narcan available, and whether or not partnerships with the employers in the city, in the region, could be a powerful way to meet people where they are and get the Narcan in the hands of a greater number of citizens.
I think everything's on the table. That's why I'm here. That's my job, to figure this out and present something to him, working with the community and working with my fellow department directors. So that's my goal in the next 3 to 6 months, is to put something together with the right people around the table to do that. So I think anything and everything is on the table, and that's been my directive from him from the moment I stepped foot in Hartford. So yeah, I mean, I think that's something that we could look at. You know, everything for me is, I think, I don't want to have a patchwork of programs. I want to have a comprehensive strategy that we can say that the city is implementing, and we can find funding for whatever portions we can and do what we can, but absolutely.
All right, I'm gonna pull up a quote. I was a part of the research and evaluation team for the North Central Regional Mental Health Board that this year did a review of 28-day programs, intercommunity, Farrell, Blue Hills, and I want to kind of share I'm part of the faith community. I am the face for BG2G, Bring Glory to God. My name is Noemi Soto. And I wrote, it is important that people understand that recreational activities are vital to the recovery process. Active addiction essentially reconfigures the brain to primarily associate pleasure exclusively with drug use. Finding joy and pleasure in healthy ways is probably the biggest barrier to long-term recovery. Life consequences might be enough to bring an individual to seek treatment, but a life with less consequences does not sustain long-term hope if pleasure and joy are not experienced or foreseeable in sobriety. I've heard people comment on how there's a bigger, more unified work that needs to be done in this whole epidemic. And what I see is that there's this culture that is fixed on getting high, being drunk as part of joy. You know, I'm very concerned about, you know, legalizing marijuana and all of the effects, because this is the mentality and the culture that actually is counterproductive to all of the work and preventive work that we're all trying to do to stop this hunger, this appeasing of seeking the high. And the other thing that I wanted to say, something that I noticed, is regarding what Mark shared as far as why the ground troops, why we can run circles, is because a lot of the reasons why faith-based groups get involved in what we do and the ground troops is because it's personal to us. There's a lot of people, they go to college, they get their degrees, but it's not personal. When it becomes personal, you grew up in the dysfunction, you grew up with the pain, you grew up loving a lot of these people that are lost, it becomes personal. And so we don't need money to run circles over people who are making 40, 60,000 a year in their jobs because it's a mission, it's personal. So I'm 100% in agreement and alignment that the biggest financial investment should be for faith ground troops, people who have a personal passion, you know, and investment into healing this epidemic. You know, it's no secret, you got peer-run groups through Advocacy Unlimited, CCAR. The best counselors were, you know, self-disclosed as having lived through experience. You know, there's a quote in recovery, you know, the therapeutic value of one addict helping another is without parallel. What does that mean? That means that when you've been through it, people will listen if you've been through it, you know? And so more power, I feel, needs to be given to the people who have passion versus the thousands of dollars that are spent on these degrees on people that mean, well, you know, they have their place. But peer groups, Advocacy Unlimited, the Bridgers program, CCAR, these are the ones that are gonna run the mile with the fewest resources. So.
CCAR is not without resources. I'm sorry. I gotta throw that one out there. They are not without resources. Forgive me. Ramona just gave me a little brochure she picked up at the EMS conference today. They're out at Mohegan Sun gambling, so while we're here. I'm just throwing that one out there. Any questions, please? Phil?
This is for Ms. Hekeler. Got your name right? My belief is that everybody should have naloxone in their house. Everybody. Okay, like aspirin, you know, Tylenol. Everybody should have it in their house. You know, Mark and I have done some training, and a gentleman that we spoke with said he was at a house party, and the next thing you know, his nephew overdosed, and there was no Narcan. And unfortunately, he died, you know. So, in my experience, I think everybody has addiction in their family, somewhere in their family. You know, so my point is, anyhow, does it make sense for the Pharmaceutical Association to kind of, you know, like I watch TV, I see about Harvoni, I see about stuff that deals with my hemorrhoids and so on and so forth. You know, I mean, can we put something out there to say, you know, this is like aspirin. This should be in everybody's you know, medicine cabinet or within their house. I mean, this gentleman, I think, this doctor here alluded to it. I mean, if he wasn't on that airplane with Narcan, that woman probably would have died. So, you know, again, you never know what's going to happen.
The Surgeon General just in April actually issued an advisory stating that, and that's the first time I've ever seen anybody nationally. It's in conversations like this, there are people say it should be in every first aid kit in America. But then there's people, as Mark will tell you, who say that, you know, we're just a bunch of enablers. And the more Narcan we put on the street, it's just telling people to go. Right. Exactly. Exactly.
I asked Eliza if she would also talk about one of the responses to the epidemic was increasing or having more availability of medication-assisted treatments. Hartford Dispensary, Carol, and I swear new HCRC. All right, see, I can get with that one. HCRC over on Fish Fry, expanding access to treatment. Something initially that the dispensary has done And I wanted to ask Elisa if she would talk about is their IOP.
So Hartford Dispensary has started an IOP, an intensive outpatient program for not only our patients, but we're also accepting external candidates. Do not have to be on an MAT program. It's for IOP for substance use disorders. And in response to one of the questions regarding prevention for adolescents, we are also in the process of developing an adolescent IOP that will likely start in the fall, helping to bridge the gap for families with addiction as well. So you can contact the dispensary to get more information. We're accepting referrals at this point, and we'll be happy to provide you with additional resources if it's not an appropriate match for some of you that have school-age children and there's addiction in the home and you're looking for a program where your child can go, it'll be 13 to 17-year-olds, leave the school early for the day, they'll release the child to Hartford Dispensary. It'll be a 3-hour program, likely from 2 to 5 in the afternoon to evening, 5 days a week, and will also involve a family component. So you're more than welcome to start the referral process and ask questions now for the fall. For IOP, you're welcome to make referrals now for community members, family members. It's any substance use disorder, not only opioid addiction.
That's great. Mark, what is the name of the lady? Liana. Lilany. I think with I'm an ex-heroin addict. I got 7 years clean, and back then they didn't have I didn't have the gift to have the stopping early.
Si me lo quiere preguntar en español, me lo puede preguntar en español y yo lo traduzco si se te hace más fácil.
No, what I'm saying is that you people really needed a lot of fundings because back then there was no help at all. I just stopped doing drugs like 7 years ago. And I was doing drugs since 12 years old because I have a broken family. And mentally, that gets you too much in your head. That I feel that would screw me up. And these young kids these days, I see it, a lot of them go into the disturbing family functions, and that's why they out there doing what they doing, because the high is like some kind of divert you to your brain, like for that high, for those couple of seconds that you get high, you just forget about that functional families that you have, the friends, everything. You just black it out. And when you do that, you just get more high. Your body wants that high. And that's when the problem comes. And then when the kids are already deep in it, it's hard for you to get out. Because right now, I'm 7 years clean. I'm doing fine. I tried to kill myself like 17 times because I didn't want to be here. Which is, I'm seeing these young kids these days getting high in dope, which scares me sometimes because I made it. But I made it just now. I'm old. I wish I would have made it earlier because I would have done something better with myself. I'm doing something better with myself right now because I'm teaching and I'm talking with people, especially my grandkids. My kids, they are young to not pick up anything they're not supposed to. But there's a lot of kids out there that do not got that gift to have somebody like me to tell them to not pick up that kind of stuff. And mentally, they need mental health, more mental health too, because believe it or not, mental health is
be point in all these opioid epidemic. That's what I gotta say.
Yeah, I just want to compliment Alicia's comment regarding to IOP. At Hartford Dispensary, we also are providing in Spanish. I just finished running one group in Spanish, proud.
Hello, my name is Kathy Fielding. I've been basically working in this field for a long time, and I even went to school to learn more about mental health and addictions. And I want to do more because, just like the young lady said, it's my passion. But for some reason, I can't get connected in my community because there's a rule that you can't work in a program unless you're licensed, but I can't get the support to become licensed in my own community. I would have to go out to another town or another state to get the support. And it so happened I was visiting my surrogate mother, and a young lady was there, and she said her mother is using drugs again, and she wanted to get some help. And my mother said, "Why are you always here when I need you, Kathy?" I said, "I don't know. I just showed up." She needed a number, like to access line, I keep it in my cell phone, to get her mother some help. And I said, your mother's not gonna go into treatment unless she wants it. Because you cannot force anybody into treatment. They gotta want the treatment in order to get it. And so when I'm supporting Mark with Greater Hartford Harm Reduction, and we see a lot of people, you know, they're not looking for treatment, but if they needed treatment, he has people there that can give them information to get the treatment that they need. You know, and I feel as though we need more programs like that in our community, because a lot of people are scared to go because they think they're gonna get turned away, or they gotta wait 3 weeks before they either get a bed or get some services, because I've seen it. And I'm glad to be here, and thank everybody for coming.
I want to add, you know, how easy it is when something is legal. So when I was in the street at 11 years old, all I had to do was save up $4.75, and I could find whatever 20-year-old, 21-year-old who didn't have a job, still lives with his mom, to buy me a pack of cigarettes. And I would give him 5 cigarettes, and I got 3/4 of a pack, you know? Same thing with alcohol. When we pool a few kids, 11-year-olds, 12-year-olds, all skipping school, find the 21-year-old, the 22-year-old, unemployed, you know, gamer that lives with his mom, and say, hey, we got money for alcohol. Go to the package store, and boom, there he goes. And we're having a party, you know? Legalizing marijuana is I think one of the most hugest mistakes any state could make, in addition to all the other drugs like alcohol and things like that, because alcohol is a drug. It's accessible. The other thing is, we understand when we tell kids, you know, that it doesn't work, right? We understand it doesn't work. Do as I say, not as I do. We understand that. Well, when our government and our leaders also say that something is legal, kids think it's all right. It doesn't matter. So these are things, legalizing a lot of these stuff, the promotion of getting high and all this as recreational, is just so, it's that cultural element, and learning how to live life without drugs, without alcohol. You can have fun in other ways is something that I feel is really lost to this generation. Everything is computers, quick fix, you know, stimuli, alcohol, things like that. And this is the bigger cultural picture that needs to be addressed. I personally, I believe through faith, there's deeper messages and purposes that people can find. And I try to bring that and help kind of guide people into finding that deeper meaning to life and joy. That's kind of my contribution, but it's also something that I want people to start thinking. It's not just the externals. It's this bigger cultural concept that getting high is fun, and that is actually feeding the dependency on that stuff. So.
All right. You want to do this? You want to do this? All right. So what I want to do right now is acknowledge a very special young lady who was just acknowledged by the National Honor Society, a certificate of membership for Miss Elaine Johnson. Please stand. Elaine Jackson. I apologize. As a member of the Academy of Science and Innovation, the chapter of the National Honor Society. Congratulations. So, Jose, you want him?
I wanted to say something. Everyone was talking about programs and funding. We're actually part of the last graduating class for the PAC program, which is the Project for Addiction and Multicultural Competency. So when you were talking about ground workers and people having the passion, we had the passion. Every Saturday morning, we trek out to Middletown, do what we had to do. We had to do a practicum. We stalked Mark down because very few people, as Kathy said, are willing to let you in the door to get your feet wet and get that experience. And there are people out here who genuinely care, and we just wanted to put that out there.
Thank you. My name is Jose, and thanks for Tammy. I got to meet Mark Jenkins, and he gave me the opportunity to come in and volunteer. I work full-time at a radiology office. I make decent money. I remember sitting down with a friend and saying, I'm trying to get into, substance abuse field, and I'm passionate because it's personal. And he dared to ask me, how much you get paid? I'm like, well, this is how much I get paid. He goes, but why you want to get into substance abuse? I'm like, you make decent money. I'm like, dude, it's personal, I'm really sad that, like Tammy said, we was the last class for the PACS program. And if more programs are available, like the PACS program, we'll probably get more people involved and there'll be more help. And when it's personal, like this young lady said, we're the voice, we're the experience, and people like that, So thank you very much.
Hello, I'm Barbara, and they just put me on the spot, but it's all right. First of all, I want to thank Mark and George for one, because when I first came around, he did the PAC class that he told me about, and I kept wanting to get in it, and I kept forgetting, and I'm glad I made it for the last one. But also, I used to work at Walmart, and I just got tired of, my passion wasn't there. I like helping people. I don't care who the hell it is. And my passion was there, and I kept putting an application at Intercommunity, and every 6 months I kept putting an application, because I'm a determined person. I'm not going to give up. And I landed a job there, and I started out, just doing urines or whatever. And now I'm a case manager, and I help people, just like Officer Foley with the HAP program, right? Chief? Oh, Chief.
Not in about another 10 hours, you won't be calling me. You can call me Foley like everybody else.
Well, Foley. There you go. The HAP program, because I know about that program, and I'm glad that y'all have it, because y'all stop people from taking them to jail, actually, and y'all try to offer them something different. And I like that, and like I said, like they say, I'm passionate about what I do. I work 50 hours, I still come help Mark, Working with Mark is like my job, too. So, and like he said, we don't get paid doing this. I would get up anytime, and any night to do what I do.
One more piece, also in recognition of the opioid awareness, on Thursdays from 5:30 to 7:30, we have something that I've coined dinner in the conversation. They're laughing because any opportunity that I get to tell people about it, and it's mainly people coming together as a community family. We sit down family style, we eat, and we talk about things. We talk about goals, we talk about issues, whatever it is that's on your mind. So don't forget, every Thursday from 5:30 to 7:30, 1229 Albany Avenue, second floor, banquet hall. Please come.
And she's right. It's a for real catered meal, and it like goes back to what we say the old school, where they sit down, Tammy and Jose moderate, and they have a meal. I mean, a full course meal, and just whatever conversation organically arises, they take it and go. You know, so that's every Thursday, and I apologize did I bring flyers? No, that's the wrong one. That's the wrong one. That's not that one. I apologize, I didn't bring those flyers. We're going to begin to wind down. One word I want to plant in your minds. Robin knows this is coming. You know, it's going to come out of my mouth anytime we get together. And I'm glad to say I've had this conversation with Lilany. Is SIF. You know, as we talk about responding, real responses to the public health responses that matter or are the most effective are the least popular. SIF is one of those conversations, as was mentioned, a lot of times the work we do, I'm called an enabler, you know? But I tell people, if you go onto a boat and that boat began to sink and you ask for, what's the first thing you're gonna ask for? A life jacket, right? So what if I told you you can't have one? You're gonna say what? Why? Well, you knew the boat could sink, right? So I say that as an analogy, is that's what naloxone is. Things like naloxone, they're tools to help keep people alive. SIF is going to be, does anyone know what SIF stands for? Say it again. A safe injection facility. They're called safe consumption spaces. Around the world, there are over 100 of these in existence. The only one legally, well, that's most popular is Insight in Vancouver, British Columbia. They've been open for over 10 years. They've had over 3 million people come through their doors. They've had thousands upon thousands of overdoses, not one fatal. It is a supervised site, and then there also is a treatment program called On-Site, which is upstairs. So these programs organically, again, make referrals, keep people safe, keep people alive, and also make the referrals for other forms of treatment. Again, a very effective, New York just opened the door for it. A few good friends of mine, they sat in and they got arrested, you know, one day, and the following day, de Blasio signed it. They're looking at 4 of them in New York, you know, and hopefully that takes place soon and we can further the conversation. You know, again, not popular, because we're seen as enabling. But, ladies and gentlemen, this and everything we do is about keeping people alive. Keeping people alive until another conversation can be had. Whatever that conversation is depends on the individual. Ramona?
Talking about all of this is that I wasn't sure what to say because I didn't plan anything either. But my heart breaks and my heart is warmed by everything everyone is sharing. I said, and a lot of this has to do with facing our own viewpoints. And we talk a lot about stigma reduction. And what everything is talking about here, I said, and people are saying it, I work for the state. I work for DPH. I care immensely. It's not just a paycheck. And we're seeing that everywhere. And everywhere we're going, we're talking about education and changing things, talking a lot about ACE, adverse child events, everything you said, you know, that we have to talk about it. There's no more hiding it in the closet. We have to face it. We have to come together across all different communities. We have to collaborate, and I've never seen such collaboration before with any kind of things. I've been involved in public health for over 20 years, and you see, you know, Department of Mental Health and Addiction Services, you see DPH, you see Department of Corrections, Department of Consumer Protection. I mean, everybody's coming to the table because we see generations being lost. Nobody wants to see this. My heart breaks every time I hear about something. And anytime I share what I do for my job, even if it's people, professional, it's not professional that they come back and share. They sit down and tell me about someone in their family every single time. And at all the conferences I've been going to lately, educational sessions, we're always talking about how deeply it's affecting. Like today's session for EMS started with an EMS person bringing their son who's in recovery to saying, but for the grace of God, you know, someone here gave my son naloxone, so he is here, and I'm continuing to do my work. And it's been like that everywhere I go. I just went to a meeting at the CDC last week, and they're talking about new funding, more money. Where does it go? What are they gonna do? They're still making decisions. It is the government. It takes time to get everything through, but they hear you, because all they kept talking about was community-based efforts. So they hear you. So keep talking, okay?
Thank you. Any burning desires? All right, listen. Would you guys like to say anything before we close? Well,
Thank you all. I think we're aware the police department's not going to solve this issue, but we're also not trying to make it any worse for any of you. And I know Chief Rosado is going to continue moving in that direction, so I thank you for letting us be here.
I would like to thank all of you personally for coming out and making this a successful event. And we look forward to the next one. Please, if there's any information you need, there's still some refreshments here. Please stop up, get some refreshments, cold drinks. There's some nice fattening snacks and still some beef patties. So again, thank you for coming out, and have a great night.
My name is J. Stan McCauley, and I do business as Light Source Productions. I provide professional services in the area of strategic video communications. First, what we do is we help you craft your message using what I call the rule of the 5 W's: who, what, when, where, and why. We do event documentation, content acquisition, full-scale productions, editing, and of course distribution through our social media television network. And with social media, video is more important now than it has ever been. Whether you're talking big business, small business, nonprofit, church, or just an individual. Let's say you plan you're planning an event, a wedding, whatever the case may be. But let's say a big event, but no video. And you spent all this time, all these hours to put this event on, and maybe 100, 200 people attend the event. But more important than that is that thousands could attend by watching it on social media. But of course, you don't think about this until after the event is over. You can't afford not to capture it for social media. And despite what people think, I am affordable. Give me a call. Let's plan your next video project and share it with the world on my social media television network. I promise you that you will have the attention of one person, me.